Hi everyone, my name is Emily Bogdan and I'm doing my presentation on exhibitionistic disorder, otherwise known as exhibitionism. Exhibitionistic disorder is considered a paraphilic disorder in the DSM, and it is categorized as a courtship disorder along with frotterism and voyeurism. There are only two criteria in the DSM for this disorder. The first is a recurrent and intense sexual arousal that comes from exposing one's genitals to someone who is unsuspecting, as manifested by fantasies, urges, or behaviors. And criterion B is that the individual has acted out on these sexual urges with someone who is non-consenting, or the sexual urges or fantasies have caused them to experience clinically significant distress or impairment in social, occupational, and/or other important areas of functioning. Some of the specifiers that are included, the first section are the target of the exposition. The individual can either be aroused by exposing their genitals to prepubertal children or to physically mature adults, or the third category is to both. And then this condition can either happen in a controlled environment, which means that they are probably living in a facility for disorders such as this one, where it's difficult for them to expose their genitals. And then in another case, they could be considered in full remission if they have not acted on their urges on a non-consenting person, or there's been no distress or impairment for at least 5 years in an uncontrolled environment. So for the course, typically adult males report that they first become aware of these sexual urges during adolescence, and this occurs somewhat later than the typical development of normative sexual interest. Little is known about how this disorder persists over time, but the course is likely to vary with age and other contributing factors, such as the feelings of guilt, frustration, and loneliness, or comorbid disorders. As is the case with other sexual preferences and disorders, older age could lead to decreased exhibitionistic urges and behaviors. For prevalence, the true prevalence is unknown according to the DSM, although it says that the highest possible rate in the general male population is likely to be 2 to 4%. And prevalence in the general female population is uncertain, but it is believed to be far lower than in the male population. Most people with this disorder do not seek treatment until they are arrested, so information on prevalence generally comes from the criminal justice system. And many witnesses to exhibitionistic acts do not report those acts, meaning that people who see someone else expose their genitals tend not to report it. And this is especially true for cases in which women expose themselves, which could contribute to the fact that there's a lower prevalence for females. One of the sources that I read talked about how men who witness a woman exposing herself could be at greater risk for getting arrested for voyeurism than the woman would be for getting arrested for exhibitionism. In terms of prognosis, in patients with exhibitionistic disorder who go through proper treatment, the reoffense rate is close to 0%. And then in cases where exhibitionistic offenders also have an antisocial history, antisocial personality disorder, alcohol misuse, and/or pedophilic sexual preference, the risk of sexual recidivism might increase. There isn't a lot of other information in the DSM on the prognosis of this disorder. For cultural considerations, there's actually no section in the DSM under exhibitionistic disorder that discusses cultural considerations. However, some sources that I read talked about how there are different sexual norms across cultures, which makes it actually more difficult to diagnose this disorder in all places and for all people with the symptoms. Additionally, in present day, in cultures where advanced technology is prevalent, it's easier for individuals to expose themselves online. And unsolicited, quote, dick pics are considered sexual harassment and an example of exhibitionism. These may not be as commonly understood to be acts of exhibitionism. One may initially think about a flasher who walks on the street wearing a trench coat, but in the 21st century, people can expose themselves online very easily. So some theories on the etiology of this disorder that I found include hypersexuality. So some might think that men with this disorder are just hypersexual. However, there's also some research that shows that this might not be the case because these men do not actually masturbate more often than the average man does. I mentioned at the beginning that this disorder is considered a courtship disorder within the paraphilic disorder section. And some people believe that this disorder comes from an inability or misunderstanding of how typical courtship behaviors occur. And people with this disorder are actually just skipping steps in the process and jumping to the derobing stage. However, this doesn't explain why comorbid paraphilic disorders occur. For example, if someone has another paraphilic disorder that includes another step of the courtship process, that it wouldn't make sense for them to not understand courtship in general. And then another explanation could be intellectual disabilities, but a source that I read on this talked about how this is actually counterfeit deviance because individuals with intellectual disabilities should not be diagnosed with this disorder if they don't understand that their behavior is inappropriate. And finally, another explanation could be narcissism. A lot of men with this disorder may want to show off. They may want the women that they expose themselves to be impressed with their penis size or for other similar reasons. One of the sources that I read that talked about the history of this disorder mentioned that Rousseau was actually the first self-confessed self-exhibitor. I thought this was an interesting fact because that's definitely not something you learn in school about Rousseau. And he lived in the 18th century. And then the first mention of the term was in France in 1877, and it was the disorder was described as a mental alienation. And then it entered the English language in 1879. The earliest American contribution to this disorder is in a brief note in the medical record that stated that exhibitionists were very numerous in New York City. And then finally, the term has almost always been associated with criminal behavior. Throughout this entire article on the history of this disorder, it always affiliated with this behavior with criminal behavior, and today it is also illegal to expose oneself publicly, especially to a non-consenting person. For the assessment of this disorder, all the sources that I looked at basically talked about different things. I think it's somewhat difficult to assess, or there's no one instrument used to assess it. But one method could be to ask the patients not to expose themselves and then assess their response to this question. They may say that they have tried to stop or that it doesn't work for them, and that they've had the problem for as long as they can remember, and this would show that this isn't just a one-off problem for them, it's actually reoccurring. Another method is voluntary phallometric testing. This is when patients listen to audio tapes of different scenarios that would be arousing for individuals with different types of this disorder, and then their levels of arousement are tested. And then some other tools that are used are tools that are actually designed to assess different disorders or personality assessments, but they can come in handy for this disorder as well. So those include some of the personality assessments that a lot of you have probably heard of, and then different depression and anxiety inventories, as well as these 4 inventories or assessment tools that are related to sexual behavior that I have listed here. For treatment, as per usual, cognitive behavioral therapy has been seen to be effective in the treatment of this disorder. And it's helpful to explain to individuals that although nudity is normal, exposing yourself to a non-consenting individual can actually be traumatic to that individual. And then another treatment method is the gonadotropic releasing hormone treatment. And this is a hormone treatment that's used to treat some paraphilic disorders. And then there's no true medical treatment. However, some people have found effectiveness in medications used to treat anxiety disorders, mood disorders, attention deficit disorders, and psychotic disorders. For the differential diagnosis of this disorder, obviously other paraphilic disorders are similar, specifically the courtship disorders. However, those are distinct from exhibitionistic disorder because for voyeuristic disorder, that does not involve exposing oneself. And then for frauderistic disorder, that typically involves touching or rubbing against a non-consenting person, and exhibitionistic disorder does not involve any sort of touching of another person. And then conduct disorder and antisocial personality disorder are relevant because exhibitionistic disorder typically involves illegal activity and norm breaking, which are also commonly seen with these disorders. However, those disorders don't involve exposing oneself either. And finally, substance use disorders, because individuals may expose themselves while intoxicated, but without repeated exposure, one would not be diagnosed with exhibitionistic disorder. Finally, I have my case presentation. You're welcome to read this on the screen, but I will also read it out loud. So Jonathan is a 26-year-old Caucasian man who has never had a successful romantic relationship. From the time he hit puberty around the age of 14, he has had strong sexual urges that he has always known were inappropriate. He exposed his genitals to a 13-year-old girl who lived in his neighborhood for the first time when he was 15. She had been walking her dog while he was mowing his lawn, and he felt the urge to expose himself to her. Once he discovered how much he enjoyed exposing himself to unsuspecting people, he began to do so regularly. He was fired from his job mowing his neighbor's lawns when one of the homeowners noticed what he was doing. He has had a difficult time holding a job ever since. He graduated from high school with very low grades and did not continue his education. He was arrested for exposing his genitals and now lives in a facility meant to treat patients with paraphilic disorders and has not exposed himself to any non-consenting individuals for 8 months. Finally, I have my references. Thank you so much, and I hope you guys have a nice winter break.